Did you know that the keys to solving chronic illness puzzles can often be found in the intricate details of personal health history and lab results? Stick around to find out how to advocate for your health, interpret the nuances of your body's signals, and navigate the often overlooked realms of functional medicine. Unlock the secrets and join the collective's waiting list. By joining the waitlist at thediscoverydoc.com, you'll become an insider, getting insight, knowledge, and perks only available to this list. Don't miss out on the chance to receive regular updates on our progress and launch times for courses and community. Get insider tips and resources delivered directly to your mailbox to enhance your wellness journey. And also get exclusive offers and early access to the collective. Join the waitlist today and become part of the collective's inner circle. Your wellness journey awaits. Visit thediscoverydoc.com and click, yes, I want to be an insider. Welcome back to the Discovery Doc podcast. I'm your host, Annah Kate, medical mystery overachiever, alongside my co-host, Dr. CeCe, Doctor of Nursing Practice. And we're headed back to episode number 4 for this week. We're going to touch on 3 key discoveries: the comprehensive care approach, understanding lab results, and advocating for functional medicine. You don't want to miss this. For a deeper understanding and a more detailed insight on how functional medicine can dramatically alter health outcomes, revisit the full discussion in episode 4. It's packed with valuable takeaways that could redefine your approach to health and wellness. Let's dive in.
But I will never turn down when a patient is seeing specialists or when they're doing imaging or doing any of that. I will never turn it down. Why? Because the information, it's better to have the information. Right. I would rather you get that information and there's nothing, air quotes, nothing that can be done about it, or there's some sort of answer. I don't ever want to discourage a patient seeing somebody else or following through with their specialist, because if there is something that's missed, that is what I think about. Because a lot of patients come to me and they're like, well, can I stop seeing my endocrinologist now? And I'm like, no, not right now. No, like that's been a core part of your stability or where you are. Let's just keep things status quo until we see what's going on. But I will always take that additional information. What we do with it is a different story, but I will always encourage that extra information.
Right. And it's also, again, going back to having a medical team that, you're looking at things from a much wider perspective of what is optimal. What are the things that we can do for you, and look at all the things. So if you've done, discover, this is for you. If you've ever done labs, find them all, all of your records and kind of categorize them and see what your patterns are, because your baseline or your reference range is your reference range. So It's not, again, we don't want to compare ourselves to Sick America, but what your number, how they track. And I'm chronically, my white blood cell count is low. Like 3 is a high number for me, but I can go and see it's 1.2, 1.3, like all of those things. And then it's progressed where 3 is now kind of normal for me. But I wouldn't have known that. And 3 is still not optimal for, so it's not.
I like it about 6.5, 7.
Yeah. Yeah. But for me, it's a big change from 1.2 for years. So having your reference range as an individual provides more information over a long period of time rather than comparing to.
Exactly, because not everyone fits in the box. There is, like you said, your reference range is your reference range. Your baseline is your baseline. So that's also very important to know, and women versus men too. And just where we are, and things like that change all the time too. What was going on? Was it a stressful time? Were we sick? What did we have? Was it crazy at work? Were we dealing with 4 kids at home? Like what was happening? Because our cells respond to that too. Right. So it's great to understand your body. And I don't think a lot of people do. And on the flip side, or I shouldn't say that they don't, it's that we're not educated on how to.
Or how to pay attention to a headache's just a headache. No, it's not. There's
it's not
something else going
on.
Right.
PMS is not normal. Headaches are not normal. Bloating after every meal is not normal. but society likes to tell us that these things are normal. But one thing that I try to do, and my follow-ups are super thorough because of this, and Heidi yells at me all the time because I take forever.
Heidi, quit yelling at her.
I know.
She's doing a good job.
I'm doing my best, okay? She's my nurse. She runs all my patients, but it's because I like to explain everything. And I say this, I'm like, this is your body on paper. All of these labs are, yes, they're, it's at my discretion to suggest what labs to do that's appropriate at this time. But these are not my labs. These are not my practice's labs. This is your body on paper. And what good is it to you if you don't understand it? So no, I don't have the time to sit in there and, go through everything I've ever learned in my life and how I come to the conclusion of interpreting those labs. But you better believe that my patients walk out of that meeting understanding the ratios, understanding what I'm looking for, understanding what we need to improve, understanding the things that are there that shouldn't be there. And I mean, it takes an hour, sometimes an hour and a half to go through all these labs so that you're not just getting a piece of paper that tells you what to do and you have no idea why.
Right. And it's so important, and it is such a game changer of being on the receiving end of, because I've worked with you before in the past of, like, she's like, tell me your story. And then she's like, okay, well, these are the things that I want to track and check and do. And then when those results came back, it was like, okay, this is what this means. And she asked me last week, what are your lymphocytes and your neutrophils? I'm like, I don't know. She's like, what? You don't know that number? Like your phone number?
Off the top of your head? Yeah, right.
No. I mean, I can go and find it. And of course, going into, we'll do a whole episode on my binder of putting it into a spreadsheet, so that once, because it's a little overwhelming starting from scratch if you're chronically ill like I am. I have had a stack of papers that I had to go through and organize and get all that information. But when you have new tests done, putting that on a spreadsheet and creating a thing, because once you put everything in, it's just easy to go and fill in.
Right.
But then I can take it to a specialist or another doctor, and I can bring it into her office and say, okay, this is since 2016, here's all of my labs. She's going to notice a pattern faster than anything else. It's going to give her way more information than I could just sitting there talking to her and telling her all my history. Then she can ask pertinent information about, hey, your lymphocytes go like this, like what's happening, like, so what happened in 2018.
Just stop for a second, do some math, and not just throw people on drugs to do it.
Right.
Can we do that? Can we?
Let's do that.
Okay, let's do that.
Again, it's understanding your body, what's happening, what's going on. Like, so, there's the pre-diabetes panel. It's like, okay, let's look at your diet, your exercise, and are you hydrated? If you can address those three things, probably fixes a lot of what Western medicine would just throw a pill at.
Right. And there are so many, anyone in that like 5.7, 5.8, 5.9 category, there are so many good natural agents that we can, lifestyle is massively important there, right? But genetics also play a part, to do in it. And so there are some natural agents that are awesome for those people right on the cusp that, hey, let's do this for the next couple months. We're going to keep it on our radar. We are going to absolutely retest you, but I'm not just going to jump right to metformin or, a drug. There are so many other things that can be done. And I think that's one thing that's a little different about me when I practice is you have practitioners, whether they are PAs or naturopathic doctors or nurse practitioners or whoever in the functional medicine field, and they are heavy on the naturalistic side of things, which is amazing. But I try my best to cherry pick. I try my best to take the best sides of all medicine. There's a place and a time for every type of medicine.
Absolutely.
Conventional.
Are you or do you know a mother-to-be? Transform your pregnancy and postpartum journey with the Ultimate Pregnancy and Postpartum Guide. Discover a wealth of essential resources and practical tips for healthy and joyful experience. This 30-page comprehensive guide is packed with must-have supplements, safe healing modalities, nourishing recipes, and expert advice to support you during pregnancy and beyond. This guide includes 2 exclusive bonuses: Bonus number 1, home birth essentials checklist. Ensure a smooth and stress-free home birth experience. Bonus number 2, navigating mastitis naturally. Explore natural remedies to alleviate discomfort and promote healing. Don't miss out on this invaluable resource. Download the Ultimate Pregnancy and Postpartum Guide today and embrace a holistic approach to motherhood.
Medicine is life-saving, in certain situations. It can also be detrimental in certain situations. But hey, so can herbs, So it's about picking and choosing the best aspects of all types, whether it's homeopathy, vitamins, minerals, herbs, and prescriptions and peptides and whatever it is, and being able to choose the most appropriate option for that patient.
Right.
And being able to combine all those worlds together instead of being like anti one side or anti the other side.
Right.
Because it does take both. And, and I have that personal belief
Yes.
as well. For me, is I'm not opposed to taking a prescription. There's ones that I have to take. But I do want to do what I can do as an individual with my nutrition and moving my body and hydration and kind of all of that. But then if there's another option on the more holistic side of, okay, well, can I take this that doesn't typically have a side effect?
Right.
Can I do that to help support to make me optimal? But I'm not saying, no, I'm just not going to take a prescription.
Right.
Like, I understand why I'm taking it and why and what else.
Yeah.
Right.
Yeah. And I try I don't try. I do. I respect my patients' wishes. And so I will never, I do have patients who are, and I mean this in more like of an acute setting. I'm not someone who's prescribing medications for you to be on for the rest of your life. Don't get it twisted there. But I do think that there's a space where medications are needed, 100%. I just don't believe it's a solution to a long-term problem. So I do have patients who come to me who, we try to compound as many medications as we can just because they're a little cleaner in terms of ingredients. But where I will be, maybe I don't know, treating some sort of candida infection and I use a systemic candida infection. I use multiple different agents. I usually use 2 natural things. And then I come behind that and I do compound nystatin, or diflucan. And some patients are like, nope, I don't want that. I want nothing to do with pharma. And I'm like, it's compounded, it's a little different, but still, I'll explain the difference. And they're like, nope, I don't want it. I'm like, okay, great. I have no problem with that because I always have a natural option where if a patient declines some sort of prescription, phenomenal, fine, we'll do it this way. And I always ask because yes, a lot of my patients have a really bad history with conventional medicine. And so they group that prescription into that experience and they just want nothing to do with that. And so I will absolutely respect that. I'll incorporate, for that candida infection, whatever is a third natural agent to make sure that we are inhibiting that fungus. We're making sure that we're treating it for long enough, etc. And then same on the flip side where they're, totally forward and I'll tell them efficacy and how things, work. And they'll be like, yeah, let's do that. I'm like, great.
Yeah.
Perfect.
And I do think that
very
that's
flexible.
Also, and we can do a whole episode on kind of the going from, big pharma prescriptions to compounding to homeopathic natural remedies, and then even down to herbs and tinctures and kind of all of that and going through that whole spectrum. I had a really good question, then I said that. Dang it.
But that's a good point because I like to intermix all those together. It's especially for acute, things I'm treating more acutely. Okay, we find out that there is a Bartonella infection. Okay, I'm going to treat that for the next 6 to 8 weeks and then you're done. So you're only taking this prescription if there is a prescription on there for the next 6 to 8 weeks. I cannot emphasize the fact that I'm not prescribing a drug for a patient to be on long-term.
Right. And we also want to know understanding why we're taking things that you've prescribed or suggested for a short period of time. Because I've gotten so many things that end up in my basket. It's like, okay, well, you need to do this, this, and this. And it's like, okay, why?
Right.
Why am I taking, I know that you told me in the office, but I don't remember why, but I want to know.
Call on me. So one thing I do, and this is part OCD, but part also because I've been the patient. with a practitioner we both know. I've walked out of the office when I was sick and been like, what the heck? Like, what just happened?
Yeah.
What am I doing? What is this? I don't even know why that prescription get called into the pharmacy for me. I don't like that prescription. What am I doing here?
Right.
Why am I changing this? Why am I taking this? And just confused. And I never want patients leaving my care being confused. And so I know I'm very logical. I know that when we have an hour to talk about 6 labs, and these are 5 pages long each, you are not going to retain all that information, but you'll sit with your pen, you'll highlight certain things, you'll take notes on there to remember, little just kind of keywords. On my treatment plans, whenever there's a prescription or a supplement or just like a random tidbit that we talk about, I'm writing it down.
Right.
And I'm writing down why. So even for a prescription, I'll put in parentheses what it's for, what it's treating. For the supplement, I'll write in the notes why you're taking it, what it's doing, how long you're taking it for, when you're taking it throughout the day.
Right.
And I'm super OCD about that because I want you being able to look at that paper and being like, just, your light bulb's going off and you're like, oh yes, okay, we found this infection and this is how we're treating it. And it says right here that I have to do it for this long and at these times. So yeah, I never want patients walking out feeling unsure or why they're taking it. I always also, or I write it down also because I want you to be able to research. Like if there is a peptide I'm suggesting, I want you to be able to go look it up, see what it is, see the literature behind it,
right,
and make your educated decision if you actually want to do it or not. Important that if there's just always something that can be done. I'm not going to promise to cure everything on the planet. It's not possible. But I promise you that there is always something that can be done. And whether it's me who finds it or somebody else, as an advocate for yourself or an advocate for your kid, just don't stop. If you know innately that something doesn't feel right, that that your kid is not doing well, don't take whatever quote whoever they are, don't take that for the only answer.
Right.
Keep going until you find someone locally or wherever that can help you just approach whatever you're going through, your kid's going through, from just slightly a different angle. And that's my goal. When patients come to me, I'm like, I tell myself this, I'm like, I have to look at this unlike what anybody else has looked at.
Right.
I know that all the imaging is done. I know that all the normal labs are done. So what is missing? And that's what I want to find, no matter if it's a 6-month-old baby with failure to thrive, a 35-year-old who's chronically ill from Lyme, or a 70-year-old with Crohn's, and everyone in between, is what is missing here.
What are we not seeing? What piece? There's a piece to the puzzle that's just
a piece to the puzzle. Yeah.
So, and it's kind of hard. You kind of know what the picture is supposed to look like, but everybody's picture is different. So it's phenomenal that you can do that and that you can look and say, okay, well, they call it medical practice for a reason, but you have application with the practice that it's like, I'm not doing this for just no reason. There is a reason, and explaining why, and that his motor function and his cognitive function increased by giving him what he needed and turning off the things that didn't need to be there.
Exactly.
Like, that's incredible.
I mean, yes, it's very, those situations are extremely rewarding. It's not always that easy. I promise you that, but that is a good example, just how the mom knew. She was like, there's got to be something else.
Yeah. And
she knew of us because she was a patient of a different naturopath, and knew of us, from just having that experience. But she just knew something was up. She knew something was wrong. And she was like, I just need someone else's opinion here. And sometimes that's all it takes.
Yep. Fight and advocate, not only for yourself, but also for your kids. And I think that has got to be the most frustrating thing, is that you take your baby somewhere that's supposed to have answers and that's supposed to know. And then they tell you, oh, well, do this, and it doesn't work. And then you get bullied into like, well, this is either you're doing something wrong, or, well, this is all that can be done, so just keep doing it. And they pressure you and bully you into feeling like that's all that I can do then. Right. And just, I want people to feel confident enough
in themselves, and in their kid to challenge that. And you might not do it outwardly. You might not be like to that doctor, be like, no, and argue them and be like, this can't be it. But take that information, sit with it, see if your instincts are aligned with what that person is saying. And if it's not, then go elsewhere. Yeah. Keep going.
Yep. I mean, you and I went through that in our own journeys. If we went through you went through what, 30 something doctors?
36.
Yeah, I had probably 10 or 12. And most of them were specialists and couldn't figure out what was going on with me either. But it's that thing, you have to. If it is not, I mean, it took me almost 10 years to start to get, I mean, I was treated, but to get the help that I was making progress, wasn't instantly better. I'm still in the midst of my storm, but I now have a shelter over I built out my boat a little bit that I'm not completely bombarded all the time, but I'm still not in rough waters.
Right.
So
just keep swimming. Just keep swimming. But if y'all need help, please always feel free to reach out to our practice to Discovery Wellness Group. We see patients from all over. You do not have to be in the state of Georgia. I just want to be a resource and a help, even to guide you in the right direction. You can absolutely do that. You can email us at newpatient@discoverywellnessgroup.com or give us a call. Regardless, we are here for y'all.
Spread the love. Share this episode and leave a 5-star rating. If you enjoyed this episode, help us spread the love by sharing it with your friends and family. And don't forget to show your appreciation with a 5-star rating. It really makes all the difference. Leave a review and let us know your aha moment from this episode. Before you go, this is the part where we have to get a little serious. Just a little. Please remember that the information shared in this podcast is for general informational and entertainment purposes only. While we strive to provide accurate and helpful information, we're not here to replace your doctor or healthcare provider. Think of us as your friendly health enthusiast gal pals who love sharing what we know, but always remember to consult with a qualified medical professional before taking any action based on the content of this podcast. And just like the Pirates Code, this disclaimer may change from time to time, so be sure to check back for updates. Stay healthy, stay happy, and don't forget to laugh. It's good for you.